All right, welcome everybody to the August webinar for the Virginia Governor's Conference on Aging. This month's webinar, we will highlight and recognize the 2021 Best Practice Awards Advancing Innovation in Aging program. The Best Practice Awards serve to encourage organizations across the Commonwealth to develop and support programs and services that assist older adults to age in their community. Established in 2006, the Best Practice Awards recognize and encourage the replication of model programs, particularly those that foster aging in place livable communities in home and community-based services. We'll be recognizing our first, second, and third place winners, Bay Aging, Jefferson Aging Area Board for Aging, and then Inova Health System. Excuse me, I'm stumbling over all my words this month. I apologize. Just as a quick reminder before we get started, this webinar is being recorded and can be found at vgcoa.com. All of our webinars are recorded and available there to rewatch or share with a colleague or a friend. We encourage you all to share comments, questions throughout the webinar, and we will take those at the end. You can submit your questions in the Q&A box throughout the presentation, and we will refer back to those. And when the time does come to ask questions, if you would like to be called on to ask your question live, please use the raise your hand icon, and we will call on you and allow you to unmute and ask those questions. Again, thank you for joining us. We look forward to seeing you again in September, the fourth Tuesday in September at 1 p.m. and each month after that. We are also always looking for webinar suggestions, and you can send those suggestions to info@vgcoa.com. So at this point, I'm going to turn it over to our presenters, and we can hear about our wonderful award winners.
Good afternoon. This is Kathy Hayfield. I'm the Commissioner of the Department for Aging and Rehabilitative Services, and it is my honor and pleasure to be here with you today and to welcome you to this wonderful webinar. We are here today to celebrate the recipients of the 2021 Best Practices Awards that are a shining star in the cap of the Commonwealth Council on Aging. The webinar is a partnership between Department for Aging and Rehabilitative Services, the Virginia Association of Area Agencies on Aging, the Commonwealth Council on Aging, and Dominion Energy. This is the second year that we're holding this celebration virtually. Prior to that, we held these ceremonies in person. There's some pluses. We're able to share with a larger audience. When I last looked, there were dozens of you here. There were over 60 people here, and I know we have many more registered. Also, a positive is that the webinar is on the Governor's Conference on Aging website, the YouTube page with a link on the DARS Commonwealth Council on Aging webpage, and you can access it in the future. I'd like to particularly thank the DARS communication team, and of course, V4A for helping make this webinar possible today. It is my pleasure to introduce and hand the mic over to Dr. Catherine Reed of the Commonwealth Council on Aging and the chair of the 2021 Best Practices Committee. Now sit back and enjoy the webinar. Catherine, take it away.
Thank you so much, Commissioner Hayfield. It's my honor and privilege to be here with you today and to represent the Commonwealth Council on Aging. I've been appointed to 2 consecutive terms representing the 5th Congressional District. And in my final year, this past year, it was my privilege to serve as the chair of the Best Practices Awards Committee. We've been delivering these awards since 2006, and I would like to pay homage to Dr. Richard Lindsay, who was one of the originators of this idea to stimulate a system that can really highlight the things that are working well And we know that there are a lot of wonderful activities and projects and innovations across our Commonwealth. And it's impossible to recognize and reward everyone, but we are really delighted to be able to highlight what the committee has deemed as really the top important initiatives. We're also very grateful to Dominion Energy, who has been supporting this awards program since 2012. And without their support, this would not be possible. So thank you so much, Dominion Energy. So this year for 2021, we received a number of applications. Every year we receive more applications, and this year we received 19 from across the Commonwealth. It's a very competitive process, and all of the applications are well developed and really meaningful. So we hope that for those of you who have submitted, that you will continue with your good works and resubmit again. So the winners reflect relevant needs in 2021, housing access and modifications for accessibility, social connectedness and engagement and social isolation, integrated health services, and COVID responses, all critically important to supporting our aging individuals in Virginia during this pandemic. I'd also like to let you know that today's webinar, we're going to feature presentations from the first, second, and third place winners, and these will be followed by a time for some Q&A. So please feel free to post your questions in the Q&A box or in the chat box, and we will address those later in the webinar. Okay, so without further ado, I would like to introduce our first presenter. Up first, we have Josh Jamerick, Senior Vice President for Housing with Bay Aging. Josh will be presenting on Bay Aging's Stable Foundations for Older Adults Experiencing Homelessness. Josh will be joined for the Q&A session by Hunter LeClaire, who is the Program Manager at Bay Aging. So now I'm going to turn the mic on over to Josh. Thank you.
Thank you very much, Catherine. I appreciate that introduction. And I just want to say that on behalf of Bay Aging's 15-member board of directors, our president and CEO, Kathy Vesley, and all the employees who work tirelessly every day, we really want to thank the Commonwealth Council on Aging for this award. We really appreciate it. Bay Aging is an area agency on aging that's serving the 10 counties primarily of the Northern Neck and the Middle Peninsula in Northern Tidewater, Virginia. You can see here on this slide, we have 3 major service divisions that we call Bay Health, Bay Housing, and Bay Transit. And we really pride ourselves on the integration that these 3 divisions, the integration that they bring with the day-to-day services. As I said, we serve the Northern Neck and the Middle Peninsula. However, a lot of our programs have been expanding regionally, like many of our housing programs, providing affordable rental housing. Some of our transportation programs have moved regionally. We even have some programs moving statewide, like our care transitions, and even multi-state, like our Veterans Direct Home and Community-Based Services. So I just want to give you a perspective there, the breadth of Bay Aging services and diversification. Next slide, please. So this shows you Bay Aging's vision and mission, and really the theme here is a choice of services, a range of services that we're offering in order to provide and support independence. We want our folks in our community, our clients, to live independently for as long as possible. So all of the programs that Bay Aging is offering and the services we are offering work together to support the theme of independent community living. Next slide, please. I mentioned the diversification of services. These are many of the services that support the housing work that we are doing to serve older adults. You can see these categories of health and wellness, advocacy and outreach, and transportation. They're really important in how they work together to serve the folks that we are housing on a day-to-day basis with the affordable housing that we're offering. Didn't mention also that we are a community action agency. So not only are we designated by the state of Virginia as an area agency on aging, about 10 or 12 years ago, we became a community action agency, which allows us to provide even more of these services and tap into additional funding to alleviate poverty. Next slide, please. Now, this is where we get into our focus on preventing homelessness. Many of you have heard of or are familiar with the Continuum of Care, COC. It's a regional collaboration that helps to alleviate homelessness, helping people who are experiencing a housing crisis. Now, Bay Aging is the Department of Housing and Community Development recognized lead agency for the 10 counties of the Northern Neck and Middle Peninsula. So about 5 years ago or so, DHCD began to recognize the work Bay Aging was doing to prevent older adults from experiencing homelessness. Now you can see on this slide all of the entities, the categories of entities, and the groups that are involved in this, from community-based organizations, which are many in our area, to the CSB, to all 10, because we're serving 10 counties with this continuum of care, all 10 Department of Social Services are involved. Domestic violence providers, the Haven and Avalon are two that work in our area. And we have some emergency shelters who are integrating with our continuum of care. We every year do a pit count, which is a point in time count, where in January we go out and count the number of folks who are experiencing homelessness. Now, and you can see all the funders who are involved in this: HUD, Virginia Housing, formerly VHDA, the Department of Housing and Community Development. So they're all playing a role in supporting this effort to prevent homelessness. Next slide, please. Now, when we're focused on offering our menu of homeless programs, one major component is this coordinated entry service, if you will. It's a point of contact. It's similar to a no wrong door, where it's one phone number, folks in the community can call it and have immediate assistance, talk through challenges, the crisis at hand, and staff are able to link them with the appropriate immediate service. Now, that service could be permanent housing, permanent rental housing. It could be rapid rehousing, where we're getting people back into permanent housing with the hope that they will achieve that stability and continue. We log in and track all of our data through the Homeless Management Information System, HMIS, which is very important for folks in our community, service providers in our community, having a very coordinated effort in knowing who has been helped, who has been communicated with. It's a way to track what has been done. It's invaluable. And then the support services on staff with the case management that we're doing to help folks, once they get into the housing, remain there and not return to a homeless situation. And then housing navigation, as you can see, and we work with a variety of landlords and try to encourage landlords in our community to participate. Next slide, please. Now here we're talking about HUD Section 202, supportive housing for the elderly. That's a housing and urban development program that Bay Aging has been involved in for many years, since 1995. It had been our primary funding source for creating affordable rental housing for older adults. We have 10 communities in the region, and we're actually, now this funding, unfortunately, in recent years has not been as plentiful and it doesn't support the production of new housing. So we have had to pursue low-income housing tax credits through Virginia Housing, and we are developing our 11th community under that funding source. But you can see the 4,276 hours of care coordination. That's through our resident service coordination program. that does support this also. We have 367 older adults who've lived in the last year lived in 317 units of affordable housing. Next slide, please. And we're very proud of a homeless preference that we implemented about 3 years ago. In 2018, the U.S. Department of Housing and Urban Development approved our request to add this to our tenant selection criteria. At the time, it was the first of its kind for HUD Section 202s. Therefore, we had to work out the kinks with the HUD staff in Richmond and really, I think, blaze a trail to offering a new way to deal with older adults experiencing homelessness. We had this homeless preference in place for a couple of years before we realized we needed to tweak it. And we have, as you can see on the slide, a rotation of 3 categories of general applications. We have a veterans preference that HUD approved in 2010, and then the homeless preference. And we rotate between those 3 categories of applicants, and that is working much better. Now, the key is also to have the staff, the case management, to support the folks once they move in. Our residents, all of them, many of them need that helping hand to promote the stability and keep that stability going for a long time. Next slide, please. This is a photo, well, a series of photos of recently moved in, both veteran and homeless applicant who moved into our permanent housing, our rental housing. This one is in Urbana, near our headquarters. And this gentleman was extremely happy, still is extremely happy to receive the keys to his new apartment. This is the moment where you know, all the work you do, it pays off. Really, this is what it's all about. And so, seeing the smiling faces and the critical nature of this is so important. And then this picture here is our newest, our 11th development or community. It's in Gloucester, Virginia. It's called Daffodil Gardens Phase 2. It's funded by low-income housing tax credits. If you hit next slide, that's actually in the last few weeks what it looks like. So we'll be opening that up in March, and you know, so it's development, then it's operations, and it all kind of integrates together. Next slide, please. So here's our contact information. If anyone would like to call us, get in touch with. So Hunter LeClaire was mentioned earlier. She works very closely with me with these housing programs that we're offering. You could contact either one of us with any follow-up questions. But we have a passion for affordable housing and serving older adults. And I would like to entertain any questions or at that point, but thank you very much.
Thank you so much, Josh, and what terrific work you're doing there in the Bay Area. So next, we have Ginger Dillard, who is the Director of Advocacy Services, and along with Winter Broadhurst, Volunteer Services Coordinator with the Jefferson Area Board for Aging, and they will be presenting their work on Friends in Schools Helping. So thank you, Ginger and Winter.
Thank you very much, Catherine. We are also very pleased to have received the Commonwealth Council on Aging Award. And we're very delighted that this was the program that was chosen. So JABA is an area agency on aging. We serve an area that includes about 33,000 seniors. And we are seeing an increase according to this last census. And geographically, we cover the city of Charlottesville and the counties of Albemarle, Fluvanna, Greene, Louisa, and Nelson. Next slide. So like all AAAs, we have a wide variety of services to help seniors age in the communities of their choice. And last year, we directly impacted about 14,000 seniors and caregivers. We do have a particular focus on intergenerational programming, especially in our child and community centers, our adult daycare, and with volunteer services. Next slide. Volunteering is a really important aspect of our organization, and our volunteers hold a wide variety of positions within the organizations, everything from basic data entry to our board members. We know that volunteering is very beneficial to individuals, both physically and mentally. And our own surveys show that volunteers feel engaged and have a purpose as a result of donating their time, which was very relevant, particularly during COVID. And all of the hours given by our volunteers totaled is the equivalent of 23 full-time staff. And we use these volunteer hours to build our organizational capacity. So one of our outstanding intergenerational programs is FISH. And due to the school closings, FISH pivoted considerably during COVID, and Winter is here to describe our program.
Hello, everyone. I am Winter. I'm the Volunteer Services Coordinator at JABA, and I coordinate the FISH Friends in Schools Helping Mentor program. So we were established in 2004. We match seniors or adult volunteers with public school students who are needing some additional support or guidance in their lives. So we recruit, screen, train, place, and support mentors. We have done this virtually over the last year, but historically we've done it in person. And we serve a variety of different folks with this program. So not only are we serving the mentors themselves and offering them an intergenerational way to connect with people of the younger generation, but we're also serving the students preschool through high school. So we have supported one-on-one with that individual attention that is really necessary for a lot of students who may need a consistent, dependable adult presence in their life. We also work in small groups and at times with entire classes, helping build the capacity for the teaching staff. Historically, we've worked primarily with schools and after-school programs. However, due to the pandemic, we were able to broaden our partner organizations into helping refugee resource organizations as well, which has been really exciting for us. Next slide. So pre-pandemic, volunteers and students were served in District 10 of Virginia, those several counties. However, due to the pandemic, we were moving virtual, so we were able to take on volunteers out of state as well. So we still serve that same district for our students, but we can now onboard volunteers from many different states across the country. And these volunteers help in a lot of different ways, but one of them is academic support mentoring. So it's not like tutoring or subject-specific instruction like teaching, but it's helping students with good study habits, helping them with a growth mindset if they're not getting the results that they had hoped for, or even anxiety around different school subjects that they might be tackling. It's a lot like academic coaching is how we phrase it. But primarily the mentors are there for emotional and personal growth support. A lot of the students are facing a lot of transitions in their lives, especially right now, and they may not have people in their lives who are a step ahead, or for our senior volunteers, many steps ahead to give them that perspective, which is what our mentors provide. Like I mentioned earlier, they also help with teacher assistance and capacity building. Some of our teachers have reported that without mentor support, they wouldn't be able to do some of the activities that they've been able to tackle in their classroom. So that's really exciting for us. And we always ask our mentors what is their topic of interest. So if they're interested in reading, math, history, let us know. And we take that into account when we're making placements for them. So if a student is struggling in a subject, it can be really helpful to match them with someone who is in that career field or interested in that field to bring some curiosity to that subject for the student. Next slide. So our outcomes are kind of in two buckets, virtual support and in-person support. So our last in-person year was 2019 to 2020. And even with the closure of our local schools mid-spring semester when the survey was administered, still 100% of teachers and staff reported that they saw an increased improvement in these categories, at least one of them. Many have seen improvement in all of them: enthusiasm, social skills, confidence, academic engagement, and work habits. For virtual support, we knew our numbers were going to be different this year, like everything else. And a lot of the students were burnt out or had shifting schedules, which did impact things. However, I do want to emphasize how much the mentors meant to these families. 80% found that the mentors helped with their confidence, and 70% found that it helped with their work habits, which is hugely important during a pandemic year when independence was more vital for the students. And those are two areas that would really help them with independent work. And then also the best feedback we could have gotten is that 90% of families and staff said that having a mentor helped their life just a little bit better. So 9 out of 10 surveyed families and staff said that a mentor was helpful for them. And that's the best feedback we could get. We were excited to be able to survey some of our families this year as well. Next slide. So the future of FISH, what does it look like, is everyone's question. We're of course going to be continuing to provide vital support both in person and virtually. We're looking forward to being able to resume in-person placements when our community's health is ready for that. But we will continue to provide virtual placement options for mentors and students. We got a lot of feedback over the last year that some families and mentors didn't want to go back in person. They loved virtual. It worked really well for them. So we'll continue to provide that as an option. We have also focused on engaging and promoting bilingual volunteer needs to support our students and to support JABA as a whole. We found that placing English learner students with bilingual mentors was really helpful for developing that connection. And then, of course, we're going to be continuing to build a resource library for our mentors that we've been doing as an as-needed basis over the last year, but we're going to continue to develop that into a digital library resource. Next slide. So I'd just like to end with some quotes directly from the people that our mentors serve so you can hear from them. One of our partner organizations said that having a dependable, consistent one-on-one meeting with a FISH mentor was a huge benefit for our refugee and English learner clients. And it was for our mentors as well. And a FISH parent said, FISH has allowed our child to engage with someone and receive the support our child needs individually. Having special time that is just for you feels wonderful and is so supportive. And that's something we heard a lot from parents this year, was that their child really needed that individual attention. And then finally, our longest standing partner, our public schools. One said, my volunteer got a very shy English learner student to read aloud confidently to her peers and teacher. And this one I love. Not only is the outcome being able to read aloud now, but it's also the confidence that's going to carry her throughout her life. For more information, you can contact me. I love talking about the program, as you can tell, and so I'd be happy to chat with you about it. And I just want to thank you all again for this award and for this time to share about the program and really lift up the wonderful work that our mentors are able to do and the connection they're able to make. Thank you.
Wonderful. Thank you so much, Ginger and Winter. What a fabulous program. And so last but certainly not least, we have Lauren Elsesser, who is a licensed clinical social worker with Innova Health Systems Medical House Calls program. So I'm going to go ahead and turn the microphone on over to Lauren.
Thank you so much, and good afternoon. My name is Lauren Elsesser. I am the clinical manager and I support Innova's medical house calls program. I'm honored to be here with you all today to share about our dedicated and compassionate team and to explain all of the amazing ways that we take care of older adults in the Northern Virginia region. Next slide, please. Inova is Northern Virginia's leading nonprofit healthcare provider, and our mission is to provide world-class healthcare every time, every touch to each person in every community we have the privilege to serve. At Inova, we have about 18,000 team members. We serve more than 2 million individuals annually. And we do this in a variety of different care settings, not to mention, our hospitals, but also primary and specialty care practices, emergency and urgent care centers, as well as outpatient services. And as the region's leading nonprofit healthcare provider, we bring world-class healthcare and education, including wellness programming, to our residents, regardless of their ability to pay for services. Innova's community benefit services amount to hundreds of millions of dollars each year. And we provide community benefits through subsidized health services, free or discounted as charity care for low-income residents in our community. We are very proud as the Inova Medical House Calls program to provide primary care for individuals who are over the age of 65 and who do not drive and are interested in retaining one of our providers as their primary care provider. Our program bills just like a normal doctor's office would. Generally, our patients, being that they are over the age of 65, are Medicare recipients. That would look like 80% being billed to Medicare, and then the remaining 20% is typically covered by the patient's supplemental or secondary insurance policy. Most of our patients don't have any additional out-of-pocket costs associated with our in-home primary care services. We currently serve over 700 patients through an interdisciplinary team, which is comprised of one physician assistant, 4 nurse practitioners, as well as RN case managers, social work case managers, licensed professional nurses, and of course, our administrative support staff. We collaborate with our patients and other members of their care team to provide the most comprehensive care that we can for our patients. Next slide, please. The Medical House Calls program serves 51 zip codes across Northern Virginia, which strategically support and surround our 5 Inova hospital campuses. These zip codes represent the areas where the majority of patients are transported into these Inova facilities for emergency care needs. Next slide, please. One of our program's primary goals is to, in fact, reduce those presentations at emergency departments, emergency department utilization, as well as recurrent hospitalizations for our patients. Through the Medical House Calls program, we accomplish these goals by providing routine chronic disease management and urgent sick visits in the home for our patients. In addition to that, we are proud that we're able to coordinate in-home diagnostics for our patients, such as EKGs, echocardiograms, ultrasounds, x-rays, and lab draws, to name a few. As a Medical House Calls patient experiences a 55% reduction in hospitalization in the 90 days that follow their admission to our program, as compared to the 90 days prior to coming to our services. This is something that clearly is a satisfying factor for not only our patients, but insurance companies, and then benefits our overall health system. Many of our homebound patients experience loneliness and social isolation as they have limited interactions, and they are very delighted when our team members visit. Our interdisciplinary team continually assesses for the biological, psychological, and social needs for our patients. Our social workers provide counseling and emotional support to patients, as well as linking them to resources for long-term and or mental health support, either in an inpatient setting or also coordinating for that to be taking place in their homes. Polypharmacy, or the simultaneous use of multiple drugs to treat a single ailment, is something that we see often across the older adult population. Our providers work with patients and families to educate them on the risks of polypharmacy and partner with our patients to work towards a best possible medication reconciliation or paring down of their med lists as we can possibly achieve. 82% of medical house calls patients have completed an advanced directive. We have goals of care conversations with all of our patients every step of the way. We provide education and support to families, including risks and benefits associated with medical decision-making, and we help to support them in evaluating their end-of-life wishes. Next slide, please. Our greatest accomplishment in 2021 was administering COVID vaccines to our homebound patients. We were one of the first to operationalize in-home vaccines, and our team did so with great enthusiasm and in a very short time frame. On January 18th of this year, we received notification that we would be obtaining Moderna vaccines for our medical house calls patients. And within a 72-hour turnaround time, we operationalized, beginning to work off a master patient list, calling all of our 700 plus patients one by one to offer them the vaccine and get out to fill schedules and provide vaccinations for our most vulnerable patients. Between January and March of 2021, the Medical House Calls program administered 1,260 doses of the COVID vaccine, resulting in a total of 655 vaccinated homebound older adults and their family caregivers across the Northern Virginia community that we support. On March 10th, we vaccinated our final patient and achieved our goal of 0 wasted doses. Our team was blissfully exhausted from the experience, but as exhausting and challenging as those months were for our team, the experience drew us together in such a cohesive and unified way that we were just incredibly joyful for being able to offer that to our patients, and really deepened our connection with one another as a team as well. That privilege that we're given to be in patients' homes every day and welcomed into their homes with open arms was really made all the more special by that experience. Being given the gift of vaccinating those chronically ill patients was certainly a privilege that we will all very much hold near and dear to our hearts for a very long time. Next slide, please. In 2022, Medical House Calls is focused on a few exciting new endeavors. The first new initiative is an ultrasound pilot. Our medical director, Dr. Susan Hullen, will lead the charge in cross-training our providers to perform in-home ultrasound diagnostics for our patients. Our goal is to further decrease emergency department utilization and hospital admissions by ruling out commonly experienced health concerns in a very proactive way. Additionally, we will begin offering pharmacy consultations for select patients who have complex polypharmacy concerns. Our goal with this pilot is to have a pharmacist visit the patient in their home to provide intensive review of medications. Our highest patient utilizer has 42 medications on their med list. So that really kind of highlights the rationale or the why behind this initiative and why it's so important for our patient population. So we're very excited to partner with our internal Inova Pharmacy colleagues to begin providing this service and support for our patients. In addition to that, we are increasing efforts to provide Medicare annual wellness visits to all of our patients every year. Depression is certainly not a normal part of aging, and we want to be sure that we are assessing for that through the Medicare wellness visits, and then providing a treatment plan for symptoms accordingly. Next slide, please. You can refer to the Medical House Calls program by calling our main office number. One of our team members would speak with you to discuss a patient and or family to discuss our program, screen for eligibility, and then we would proceed with our admissions process. We take care of individuals in private residences as well as in care facilities. Next slide, please. And certainly last but not least, I wanted to share a quick snapshot of our wonderful provider team, Dr. Susan Holland, our medical director, Stephanie Shepard, physician assistant, and our nurse practitioners, Elizabeth Hill, Regina Cosson, Danette Nichols, and Leah Teese. Next slide, please. For additional information, please visit our website and please feel free to reach out with questions at any time. I really appreciate your time this afternoon. It was a great honor to receive this award, so thank you all.
Thank you so much, Lauren. And I would like to once again say congratulations to all of the award recipients. And now I would like to introduce Bill Murray. Bill is the Senior Vice President of Corporate Affairs and Communications with Dominion Energy. And he has been a longtime supporter and champion of the Best Practices Awards and of aging services in Virginia in general. Again, it's without the support of Dominion Energy, these awards would not be possible. Thank you so much, Bill, and thank you, Dominion Energy. And I'm going to go ahead and turn the mic over to you.
I'll be very brief. I promised the commissioner I would do this in 2 minutes or less. Like a lot of Irish Catholics in the United States with Boston roots, I've got a picture of John Kennedy that hangs in my office. And I was thinking today about a quote by President Kennedy that I rather like, that I think is sort of relevant to what we're talking about. On the basis of his study of the world's great civilizations, the historian Toynbee concluded that a society's quality and durability can best be measured by the respect and care given its elderly citizens. And then we would say aged citizens today or aging citizens today, but for President Kennedy used the vernacular of his time. And what I particularly like is the emphasis not just on care, but also respect. And part of respect is showing a way to make contributions. And that's why I like the awards today, because the awards today dealt with housing, they dealt with health, but they also dealt with opportunity to contribute. Because we all remember President Kennedy's very first words in taking office were ask not what your country can do for you, rather ask what you can do for your country. And as we have the largest cohort of aging citizens in history, it's very important that we not just think about this as a dependent population, but as a population with a lot to contribute, a lot of wisdom, a lot of experience. And I think our awards today speak to that. It's a great pleasure always on behalf of my colleagues here in Virginia, my more than 10,000 colleagues here in Virginia, our shareholders, and the company's leadership generally. I just want to thank you for continuing to celebrate best practices in aging. I know I'm a broken record every year. The oldest boomers are now 75 years old. So this issue has never been more important. With that, I will yield back to your program.
Thank you so much. And again, thank you for your support of this program. And so now we would like to open up the floor, our virtual floor, for some questions and answers and discussion. I'm going to turn it over to our moderators to help us with this.
We do have one question that I've seen come in, and at this point, we've just gotten a lot of praise for the project, so that's very exciting. But specific to the JABA program, Joan McDermott asks, what kind of training do you provide the mentors?
Thank you for that question. That is the key to a good mentor program is good training. So we've developed a rigorous training for our mentors. Now it's administered through Zoom. It includes academic coaching, emotional growth, building connection, and safety policies and techniques. We also review the training each year, and we receive feedback from local teachers and now families to update the training for areas for mentor growth. And we're pleased that when surveyed, both mentors and teachers feel like the training has equipped them for what they would encounter in their service.
All right, great. Thank you, Winter. We don't have any other questions at the moment. I'll remind people if they have questions about any of the specific programs, they can enter them in the Q&A box, or they can also use the raise the hand icon and we can call on you and you'll be able to unmute yourself and ask directly. In the meantime, Dr. Reed, while people submit any more questions they might have, We could look at the slide with the honorable mention programs and talk a little bit about that as well.
Yes, thank you so much. Again, we always receive so many amazing applications for these awards. And so I do want to acknowledge the 2021 honorable mentions, and I'll just read these to you. First, we have Senior Services of Southeastern Virginia, and their project was titled The Art of Healthy Aging. Next, we have the Fairfax County Department of Neighborhood and Community Services and Service Source Incorporated, and their project was titled Virtual Center for Active Adults. The Appalachian Area for Senior Citizens submitted their materials for their project titled Home Repair Program. The Arlington Agency on Aging submitted their project Calling Angels Friendly Caller Program. Senior Connections, the Capital Area Agency on Aging in the Richmond area, submitted their project Benefits Enrollment Center. And last but not least, Volunteer Solutions submitted their project, the Virtual Social Visitor Program. All of these projects were so worthy, as were all of the applications for awards that we received and reviewed in our committee. We are just inspired by all of the many good works going on in our Commonwealth. And I hope that you will join us in spreading the word about these opportunities to submit and have work recognized, because what is important about that is we have the opportunity to share your success across our Commonwealth so that others might want to work on something similar or implement what you've done in their local region. Okay, there we go. Do we have any more questions?
Doesn't look like we have any more questions at this point. I think, at this point, we would just move forward with, again, thanking our presenters, thanking you, Dr. Reed, for leading this webinar, and for all of our other guests, Commissioner Hayfield, Bill Murray, Charlotte Arbogast, who helped us put together this presentation and highlight our winners. And thank you for them being with us, and congratulations to not only our first, second, and third place, but our honorable mention. Again, this is being recorded, so you'll be able to find this at vgcoa.com if you want to share it. And in the future, we look forward to seeing you on the fourth Tuesday of every month from 1 to 2 o'clock. All upcoming webinar information can also be found at vgcoa.com, or you can email info@vgcoa.com for more information or suggestions with future webinars. So I thank you all for joining us, and we look forward to seeing you next month.